Good afternoon. Thanks everyone for coming. We are still dealing with a rapidly evolving disaster. Today I will try to let you know what we know right now and continue to provide updates as the picture becomes clearer. The extreme magnitude of damage caused by Tuesday's earthquake in Haiti is making it extremely difficult for us to accurately assess how many people have been killed and injured. Homes have collapsed, buildings are in rubble, and many roads are blocked, others difficult to navigate, and communication remains incredibly difficult. No confirmed, I'll repeat, no confirmed number of dead or wounded has been provided. Our efforts must be on the living and to rescue as many live people as possible. What I am personally finding is that virtually every person I talk to has some story, a friend of a friend, or indeed a family member that has some link or has been affected in some way by this crisis on the ground in Haiti. So it should serve to remind us that we're talking about people, we're talking about families and their children, not just numbers. At least eight hospitals that we know of and other health facilities have been substantially damaged or destroyed in Haiti. The airport is now functioning and receiving planes with aid and relief teams. Because of the damage, we know that night landings are being restricted. We know there's a field hospital functioning at the airport and an Argentine military hospital that is also functioning. This hospital has been open for public use and is providing health services as we speak. Countries such as Chile are providing additional medical staff to work in this hospital. We know that many other hospitals are still functioning but are crowded with patients in dire need of a wide range of care, particularly for trauma injuries. At this phase of the crisis, we have two major concerns: searching and rescuing the trapped victims who may be still alive, and to that end, several teams and missions are currently working and other teams and missions are arriving. Our other major concern is the coordination of the health response. Basically, how we can most efficiently and effectively use the wide range of life-saving resources and skills coming to Haiti. Before this briefing, our director, Dr. Mirta Rosas, coordinated a call with all the countries of Latin America and the Caribbean. What countries have already done and what they plan to do, I must say, is extraordinary. Their response is really an exemplary example of the solidarity of our region. Specific examples include Chile sending a medical team to support the Argentine military hospital already operating on the ground, Ecuador, Peru, and several other countries providing medical supplies, Cuba sending medical teams, Brazil sending plane loads of equipment, medical supplies, and staff. Jamaica is now receiving the overflow of patients into its nation's hospitals and has also been sending several medical staff by their Coast Guard directly to Haiti. Venezuela has sent plane loads of staff and fuel, and certainly the response from US and Canada has been extraordinary. And the list goes on and on. I need to also mention that these efforts are not just local in our region. Countries from Europe, UK, France, and Spain in particular, and as far away as China are sending support. Many representatives of smaller aid missions and even individuals themselves have contacted us offering to volunteer, and many of them with incredibly valuable skills. But right now the situation is so difficult on the ground that we must recommend and must ensure that all aid teams be completely self-sufficient. Aid teams must be able to meet their own personal needs for water, food, and shelter, as well as having their own equipment and facilities to provide their services. And this is for obvious reasons, knowing what we know about the damage on the ground. But we're compiling a roster of people who have offered their skills, and to have them available, particularly in the recovery period, when we have more data from the needs assessment that is currently taking place on the ground. We also have guidelines on how to be a good donor partner, or in other words, a good humanitarian, a good citizen. And these guidelines are available on PAHO's website at www.paho.org, paho.org. Our immediate priorities right now are search and rescue of survivors trapped underneath the rubble, treatment with major trauma injuries, preventing the infection of wounds, the provision of clean water and sanitation and food who need those items most, and control of communicable diseases such as diarrheal diseases and respiratory infections that could be severe consequences of the immediate crisis. So let me go on and speak in more detail for a moment about what PAHO WHO is doing. Coordination is the key role that the Pan American Health Organization and WHO can provide. PAHO is working with the Haitian government, United Nations agencies, and humanitarian partners to respond to the emergency and to assess the specific health needs, as I mentioned previously. Our PAHO Emergency Operations Center is operating as a clearinghouse for information. We are conducting daily global conference calls with our colleagues at WHO headquarters in Geneva and with all its global health cluster partners to best coordinate the response to the emergency. PAHO WHO has already deployed a 12-member team of health and logistics experts to Haiti. They include specialists in mass casualty management, coordination of emergency health response, and the management of dead bodies. Data collected by PAHO WHO is being disseminated to other humanitarian aid partners. As I mentioned earlier, many of these partners are already operating in the affected areas and are sending additional support. As I described in coordination with PAHO, neighboring countries in our region are already in the process of organizing humanitarian response by sending aid missions and search and rescue teams. PAHO is a technical agency and as such provides technical support in disaster management. Provision of health services is critical in this area of work. Another example in a crisis like this will be the management of dead bodies. This needs to be done with the highest regards to families, their wishes, and their sensitivities. We need to stress again that the presence of dead bodies does not itself pose a substantial public health threat. So we have time to adhere to the highest levels of respect and follow-up. We have received reports that people are placing bodies in sheets on the streets, and there are thousands. It's been decided with the chief of the UN forces that the UN will gather these bodies and take them to a central place for the necessary follow-up with families. PAHO has issued guidelines on the management and identification of dead bodies and providing these guidelines to health authorities and partners in the country. And again, I stress those guidelines can be found on our website. As I mentioned yesterday, it's important to draw upon the lessons we've learned over the decades in responding to disasters in the Americas as well as around the world. Key to this will be the long-term strategy, and this includes the critical importance of hospitals in the aftermath of a disaster. It is not inevitable that hospitals also become victims of the destruction and consequences of the disaster. We know that hospitals can be constructed and supplied so they can withstand the impact of future disasters and remain functional to provide their essential services to survivors. The additional cost in this reconstruction period of making hospitals disaster safe is marginal and basically is negligible in comparison with the cost of a failed hospital. We sincerely hope that donor countries and agencies will place a high priority on rebuilding Haiti's health facilities to be disaster safe in the future. The short-term response must be grounded with a long-term vision. And with that note, I would like to end and thank you again for your time and consideration.